Okay, and just reiterating that the recording has just started, so folks know. And I also wanted to tell people real quick, if you just do a search, an internet search for Oregon Health Authority and Bullseye, you will get to our page with information and the email address. So you don't have to scramble to get that impossibly complicated email address down. That's another way to get the information you need and get to that email address. So as Sandy said, my name is Gabriella Goldfarb. I'm the Environmental Public Health Section Manager within the Public Health Division at Oregon Health Authority. And I first just want to thank you all for taking the time to be here this evening. We understand it's a significant commitment of time away from your families, away from other priorities. So it means a lot that you chose to come tonight. We have two main goals. One is to share the findings of the Bullseye Public Health Assessment, or PHA, as you'll hear us refer to it. And the other is to have time after the presentation for Q&A, as Sandy was saying, and for all of you to express your thoughts and concerns. I want to take a moment first to recognize any of the Bullseye PHA Community Advisory Committee members who have been troopers sticking with this process. One who said he was going to be here, although I can't see everybody now. I don't know if he's here yet, and he said he was fine being recognized by name as Chris Eikamp. So thank you, and thank you to the others of you who are here tonight with us. I also saw that Senator Kathleen Taylor is here with us this evening, and her staff. And Senator Taylor, I don't know if you want to briefly turn on. Hi. You also have stuck with this through all this long time. So just wanted to acknowledge that you are here, and thank you so much for taking the time. Are there any other elected officials here, whether from our legislature or others whose names I may not have seen? Okay. So in that case, I'll switch to introducing the Oregon Health Authority staff who are here tonight to provide information or to support the meeting. Julie Cifuentes, Julie, if you can wave, is the longtime manager of the Environmental Health Assessment Program. And you're going to hear from her next about our approach and the context for the public health assessment. Kim Pham is stepped in behind the scenes. Kim, I don't know if you can turn on your camera, and is waving. Kim Pham is the incoming manager of the Environmental Health Assessment Program, as Julie is going to be transitioning to another role in OHA. And Kim is helping us tonight, as Sandy was saying, with the behind the scenes work and the post-presentation Q&A. And finally, David Farrer, our senior public health toxicologist and the main author of the public health assessment. And he's going to walk us through the findings. I'll say we also have colleagues here from the Department of Environmental Quality. Matt Davis, yep, there's a wave. He's the DEQ Northwest Region area air manager. Lauren Wordis, and she's helping us out with popping all kinds of useful information in the chat. She's a public affairs specialist, also with DEQ's Northwest Region. And I don't know if he's been able to join yet, but J.R. Giska, yes, okay. Oh, there he is from mobile, from the car, brief wave, a program engineer with the Cleaner Air Oregon program that regulates industrial air toxics. So the main reason that DEQ folks are here with us tonight is if questions come up that relate to information in the PHA, in the public health assessment, about past air monitoring, current air conditions, that type of thing. And as Sandy was saying, the other reason is so that they can listen and collect questions that you may have about Bullseye's regulatory status going forward or other sources of pollution in the area, to potentially host a separate meeting if there's interest to answer those types of community questions. So again, Lauren either has or will put a link in the chat to a poll. If you're interested in DEQ convening a meeting like that, please respond to that poll. And if there is that community interest, DEQ will post meeting information on their Bullseye webpage. So I'm assuming Lauren will put in a link to that, but I am guessing you can also do a search for Oregon Department of Environmental Quality and Bullseye, and you'll make your way to DEQ's page, and they'll post any information about a meeting there. And I would ask, we have a lot of information to get through just about this public health assessment. So we are going to try to tonight answer questions that really relate to the public health assessment, and let DEQ again gather your questions for a subsequent meeting if it's more forward-looking about the facility and its regulatory status. So with introductions done, before we begin tonight's presentation, I wanted to acknowledge that you all have been waiting a long time, truly a long time, for us to get to this point in the public health assessment process. We really regret that it took so long, and while it wasn't for lack of caring or effort, it took much more time than it should have. We do want to get the presentation underway, so I'm not going to go into the explanation for the timing now. I'm certainly happy to provide that if people are interested in the details of why once we get to the Q&A portion of the meeting. So turning to the public health assessment, a draft for public comment has been available online since the end of June 2021. And I mentioned how you could find it. Search for Oregon Health Assessment and Bullseye. That will take you to it online, but we also are dropping a link to the report in the chat. We hope tonight's meeting is going to give you information you need to help you decide whether you want to submit formal public comment on the PHA, and if so, what you want to tell us. Those comments are due May 5th, 1 month from today. And you should see in the chat the email for submitting comments. It's ehap.info@ and that ridiculously long rest of the address. Again, you can find that email address on our website. We are happy to listen to community members after the presentation during the Q&A portion of the evening, but please note that if you want to provide formal comment on the PHA, we need you to submit it in writing. And it's really the surest way to make sure that we get your comments exactly as you mean them. Once the comment period closes, May 5th, we will consider all the comments as we write the final version of the PHA. And those final PHA, we always include an appendix where we both summarize, the public comments received into themes or categories, and we describe how we addressed each theme in the final report. But we also are going to make all of the public comments exactly as written available on our website. So that will also be a record. Also, all of the links and email that we've been putting in the chat, we're going to put them in the chat again at the beginning of the Q&A portion, so you'll have another shot at seeing those. So with that, I'll just thank you again for your presence, for your attention tonight, and I will turn things over to Julie Cifuentes.
Thank you, Gabriela. Thanks, Dave. Good evening. Before talking through some of the background in terms of what led up to the Bullseye Public Health Assessment, I want to take a moment to acknowledge just how extremely stressful and worrisome of a time it was for many people living in Southeast Portland, and I imagine for many of you, especially those living near the Bullseye facility or those who had children in the nearby daycare. When the news broke about the levels of metals in the air, it left many suddenly feeling unsafe or unsure that they were safe breathing the air in and around their homes and in the neighborhoods. In addition to feeling worried, we heard many people expressing frustration and anger and even a sense of betrayal that governmental policies or agencies hadn't done more sooner. So when we began the public health assessment, our hope was to answer and address as many community health questions and concerns as possible. Tonight, we'll be walking through the questions that we are able to speak to, as well as those that we don't have answers for. Next slide. So as many of us here tonight know, Bullseye Glass manufactures colored art glass, and this process uses heavy metals to color the glass. Bullseye began operations in this location in the 1970s, and their process and size of their operation has changed over time. So in the map here, just to situate ourselves geographically, you can see the facility located south of Powell Boulevard on Southeast 20th Avenue near Powell Park. And on this map, you can see marked the nearest daycare, as well as the nearest elementary school, which is Winter Haven, and the nearest high school, which is Cleveland High School. So starting in 2011, DEQ noticed higher than expected cadmium levels in some air monitoring they were doing in the general Portland metro area. And this didn't match with the information that they had about emitting facilities. And so they started looking for potential sources of cadmium in the Portland area. During this time, DEQ learned that the U.S. Forest Service was planning to test moss samples for pollutants in a large area across the city of Portland. The U.S. Forest Service's original plan was to be looking at other types of contaminants, but DEQ encouraged them to include metals, especially cadmium, to help DEQ narrow down the likely source or sources. So in 2013, the U.S. Forest Service started collecting samples, and that project went on for a couple of years. In May 2015, the U.S. Forest Service shared the final results of their sampling project with DEQ, and it was clear that cadmium levels were the highest in moss samples collected around 2 art glass manufacturers in Southeast Portland. I guess one was in North Portland, I believe, with the higher levels in moss coalescing around Bullseye glass. So in order to verify that this was the source of cadmium that DEQ had been searching for, in October 2015, DEQ set up an air monitor near the Bullseye facility. They sent the samples from this monitoring effort to a third-party laboratory for analysis. So DEQ received the results of that October monitoring at the end of January 2016 and immediately shared them with us at OHA. And it was clear right away that the levels of cadmium and other metals measured were alarmingly high, and the agency started working on a plan to address it. And then on February 3rd, 2016, when the story broke in local news media, there's a series of responses and actions that followed. So in terms of response, we don't acknowledge enough the tremendous energy, time, and commitment of community advocates that emerged during this time. Community members and their advocacy played a critical role in all of the response actions that are on this slide, which I'll walk through here. Within 10 days, Bullseye drastically reduced emissions by limiting operations. DEQ set up 4 air monitors around Bullseye glass and collected daily samples for over a year. This situation highlighted gaps in air toxics regulations, and specifically, what really came to light was that the regulations in place at that time were based on federal rules that did not take into account health risks to neighbors living near industrial facilities. So the situation at Bullseye prompted the governor to initiate the process for developing new state regulations that are now in place. These state regulations are more stringent than the federal regulations and are based on health risks to near neighbors. And this new program is called Cleaner Air Oregon. But because Cleaner Oregon was a complex statewide program that was going to take a while to get off the ground, DEQ quickly established a set of new rules specific to art glass manufacturers, just as a stopgap measure until Cleaner Oregon would be implemented. And those art glass rules were implemented in September of 2016. In addition, OHA offered cadmium testing and started collecting urine cadmium data statewide. And OHA also committed to doing a public health assessment. And I wanted to mention, again, community response and advocacy, because some of the things that we're talking about here really were, within, weeks or months, that after in 2016, and the community response and advocacy continued for a couple of years, especially in relation to the new industrial air toxics regulation. So Clean Air Oregon, which were those new rules were adopted in 2018. Next slide, thanks. So we heard a range of health concerns from the community over many months in 2016, and they fell into the broad categories that you can see on this slide. We heard these concerns in person at public meetings from members of our community advisory committee, many emails and one-on-one phone calls. We heard these concerns from parents of children who attended the daycare, parents of kids who attended nearby schools, employees of nearby businesses, nearby neighbors, and even from some people who live pretty far from Bullseye. And OHA's primary tool for addressing community health concerns and evaluating health risks in situations like this is called a public health assessment. And so we decided in March 2016 to start the public health assessment process. So a public health assessment is a tool developed by the Federal Agency for Toxic Substances and Disease Registry, ATSDR, which is a part of the Centers for Disease Control. And ATSDR was established in 1980 under the Superfund law, and they are charged with evaluating the health risks to those living near Superfund sites. And ATSDR developed a public health assessment process that we use at Superfund sites, as well as states across the country. And we also use those at other sites and facilities that may pose health risks to communities. And we do this work as part of a cooperative agreement with ATSDR. So public health assessment, Dave is going to go in a little more detail about this, but I wanted just to highlight a few kind of main points about what a public health assessment is and what it's not. These are based on environmental data, so primarily air, water, and soil data. They can include some health data, such as cancer data. However, PHAs are not health studies and do not involve collecting information about health conditions, symptoms, or health status. The primary question that a public health assessment answers is, are contaminant levels in the environment high enough to harm health? And if the answer to that question is yes, a PHA provides recommendations and guidance on reducing exposures and health risks. And typically those recommendations will go to other governmental agencies, but we also provide guidance to community members and others in the community on how to reduce or prevent exposures to environmental contamination. So with that, I'm going to hand it off to David Fair. Again, he's senior toxicologist with OHA and is the primary author for the health assessment.
Hi, everybody. Thanks, Julie. Like Julie said, I'm David Fair. I'm a toxicologist with the Oregon Health Authority, and I've been with the agency since 2007, and I am the primary author on the report. So this slide is intended to describe the public health assessment process. And as Julie said, the overarching goal of this process is to answer the question, are contaminant levels high enough to harm health? Inputs to the process are environmental data and community characteristics and input. The evaluation phase seeks to answer these questions that you see in the middle bubble there. What are contaminant levels? How do people come into contact with contaminants? And a word we use for that is exposure. That means exposure is the word that we use to describe how people are coming into contact with contaminants. We try to answer this question: could this exposure lead to illness? And are there relevant health data? Then in the conclusions and findings recommendation section of the report, from this process, we seek to answer the question whether exposures are a problem, and if so, what needs to be done about it. And throughout the process, community engagement is important. Early on, we formed a committee of community members who could advise us on the community's concerns so that we could do our best to make sure that the end product would answer as many of the community's questions as science would allow. And the committee also helped us ground truth some of our assumptions about how people might be getting exposed to contaminants from Bullseye. And we ended up having about 8 meetings with that committee between May of 2016 and the present. Now, I'm about to talk to you about data, like the data and the science that went into this public health assessment and the conclusions that we came to. So over the next several slides, I'm going to walk through the environmental sampling data that we used, the contaminants of concern that we identified, and the way that we accounted for time and exposure in evaluating health risk. And then I'll end with a series of slides that walk through the conclusions of the report. And everything that I'm presenting here tonight is available in much greater detail in the report itself, which is on our website. As I mentioned before, a key input to the public health assessment process is environmental sampling data. And on this slide, I'm going to try to describe the data that we were able to use. So this is a map of Bullseye glass and the surrounding area along with some where the DEQ's sample collection happened. So to help you orient, I'm going to try to use this cursor thing. So Bullseye glass is in the middle here. It's this kind of series of like salmon colored rectangles. In the middle, here's Powell Park up in right here. This is the Fred Meyer corporate offices, their big parking lot. Down here's the nearest daycare center, which is southeast of Bullseye. Over here is Winter Haven Elementary School, which is the nearest elementary school on the other side of the railroad tracks. And then Powell Boulevard is this road right here. And Cleveland High School is off the map to the east, just out of frame. Now, all these purple dots, all the purple dots are related to air monitoring. So this triangle was only a wind speed and wind direction monitor. So it wasn't collecting contaminant samples, just examining wind. The purple hexagons like this represent the actual air toxics monitoring sites where the metals were measured. And this location, Southeast Powell and 22nd, that was the location of the October 2015 monitor. That was the first monitor that went up that alerted us to the problem in the first place. And in February of 2016, DEQ used that same monitoring location again, and along with these other 3 monitoring locations. So they added one at the daycare center, southeast of the facility. They added one at Winter Haven Elementary School to the west. And then a monitor to the north was at Southeast Hague and 20th Street. So those were the air monitoring locations. Those 4 air monitoring locations collected daily samples for over a year until the end of March 2017. And that totaled over 1,013 samples. The blue and yellow markers are all soil sample locations. So that's where DEQ collected samples of soil and analyzed them for a panel of the same heavy metals that were measured in air. In all, there were 70 soil samples included in our analysis, and those 70 soil samples were collected from near the surface, just under any grass or anything covering the soil. And the intent was to collect samples that would be representative of what people would actually come into contact with in the normal course of activity. DEQ tested for a total of 9 metals in air and 12 metals in soil. And these 5 metals, arsenic, cadmium, chromium, nickel, and lead, were the only ones whose maximum measured concentration was above typical urban levels and above health-based screening values. So all of these metals can harm health if the level a person gets exposed to is high enough. And the purpose of the public health assessment is to answer that question about whether the levels are high enough to harm health in this situation. So all 5 of the metals that you see here were tested in both air and soil. And the reason that chromium and nickel don't have soil written under them is that even the highest chromium and nickel levels that were measured in soil were below typical urban levels and health-based screening values, but they were above those screening values in air. So chromium and nickel were tested in soil, but they weren't listed as contaminants of concern for soil because the levels were too low, but they were contaminants of concern for air. Health risks from air contaminants depend not only on the amount of the contaminants in the air, but also the amount of time spent breathing the air in the affected area. For air contamination, exposure happens when you breathe in air that contains chemicals. So this means that the level of risk varies from person to person, depending on how much time they spent in the area. To keep things simple, we made a near worst case assumptions about how long a person would be breathing the air in the area. We assumed that a long-term resident would breathe the air 24 hours a day, 7 days a week for 78 years. And it's worth noting that for some chemicals like chromium, breathing the contaminated air as a young child can cause more damage than breathing the same air as an adult. And we take that into account when we're calculating risk. So for that 78-year exposure, we assumed that those 78 years started from birth, and we factored in the increased potential harm from that earlier portion of the 78 years. To assess acute risk or health risks from short-term exposures, we used the maximum 24-hour concentration measured during the monitoring period and assumed a 24-hour exposure on that day. For exposures through soil, we similarly assumed that a long-term resident would come into contact with soil for 78 years, same as for air. However, for children at the daycare, we assumed that they would only come into contact with soil at the daycare for as long as they were there. So we checked with the operators of the daycare, and they confirmed that the longest an individual child could attend the daycare is for 6 years. For people coming into contact with soil at Powell Park, we also assumed 78 years, but we assumed fewer days per week than for residents playing in their own yards. The main question we heard from community members was, what kind of health risks are people facing who have lived in this area for a long time and were exposed to metals from Bullseye before the problem was discovered? We heard that question loud and clear, and we made it a priority to try to answer it. The big challenge was that we only had that 30-day snapshot of air conditions prior to interventions to reduce emissions. And that is the air data that came from that October 2015 monitoring effort from the Fred Meyer parking lot. Those 30 days of data just aren't enough to extrapolate to long-term conditions. And we don't know whether that 30 days was typical, higher than usual, or lower than usual, especially when looking out across multiple years. We tried hard for a long time. We thought through ways we could use historical purchase or production records from Bullseye and talked with experts at multiple agencies to see if there was any way to recreate conditions or to stretch that data that we had enough to answer the community's main question about health risk from exposures in the past. In the end, we concluded that there just wasn't a scientifically valid way to answer this question. Ultimately, October 2015 could have represented worst case conditions, but typical conditions could also have been a lot worse sometimes. We just aren't going to be able to answer that question. So the next couple of slides, I'm going to talk through what we did instead. We asked the question, what would long-term health risks have been if the conditions measured in the air in October 2015 had been allowed to continue long-term into the future. We thought of long-term residents who might have been born there and lived a full 78 years breathing that air. In that scenario, concentrations of metals would have been high enough to increase risk of kidney damage, decrease IQ in children living in the area, and decrease lung function in adults and children living in the area. Levels of metals would also have been high enough to increase risk of lung and bladder cancer. All of that applies to that hypothetical person who would have been breathing the air represented by that October 2015 air monitoring data, 24 hours a day, 7 days a week for many years. People spending less time in the area would have less risk. What about current health risks from air? For this set of conclusions, we were not using that small October 2015 data set. In this case, we were using those 1,013 24-hour samples collected from March 1st, 2016 through March 31st, 2017 at 4 locations around Bullseye. This was after Bullseye had reduced their emissions. This was a ton of very high quality data with every metal correctly analyzed from start to finish. So here's what we were able to conclude using this large set of high quality data. Measured levels of metals over the course of that year were too low to harm health, even for someone breathing the air 24 hours a day, 7 days a week for 78 years. Same thing for the short-term risk. Even the maximum concentrations for each metal out of those 1,013 samples were too low to cause harm after a short-term exposure. One thing this data set demonstrated is that interventions to reduce emissions from Bullseye glass were effective in reducing risk. Now, we know that there are other sources of these metals in the area, but one useful thing about the ambient air monitoring used to come to these conclusions is that they don't distinguish between sources. In other words, these monitors captured whatever metals were in the air in these locations from any source, not just Bullseye. So this gives us a picture that overall risk from metals in air is low, even considering all sources in the area. The public health assessment also includes soil data collected by DEQ in 2016. There were 70 surface samples in the analysis and 12 different metals were measured. We concluded that the concentrations of metals in soil were too low to harm health in the past or currently. Concentrations of metals were about the same as we see measured anywhere in Portland or most urban areas, for that matter. EHAP concluded that eating homegrown produce around Bullseye was unlikely to harm anyone's health. DEQ didn't test any produce, but because soil concentrations of metals were the same as any typical urban environment, there's no reason to think that the risk from eating produce grown there would be any different than any other urban garden. Metals are not well absorbed inside of plants, and common gardening practices such as adding compost, mulch, and other soil nutrients further decrease the plant's ability to absorb heavy metals. Many people got their urine tested for cadmium when the emissions from Bullseye were discovered in early 2016. And those urine test results were reported to OHA, and we included an analysis of those results in the report. There were too many scientific uncertainties and limitations with those data to support a health conclusion in the public health assessment, but the summary of the data is there. OHA also checked the state's cancer registry database to see whether or not there were higher than predicted number of people with lung or bladder cancer in the neighborhoods around Bullseye. That analysis did not find any cancer rates higher than would be predicted for the size of the population. However, there's too many uncertainties in this type of analysis to support a health conclusion. It doesn't really rule anything in or rule anything out. This table has a summary of risk for these different scenarios that we've just been through. And a similar table appears twice in the report itself, with more details on pages 13 and 45 of the report. I know there's a lot on this slide, but the intent of it was to show all of the conclusions from the public health assessment in one place. In addition to this table being in the report, we're also going to make these slides available after the presentation. So don't feel like you have to memorize it now or absorb it all. I think that this slide would be most useful looking at the slides after the presentation when you have more time to think about it. As Gabriela said in the beginning, the next phase of the process is for you to give us feedback on the public health assessment in the form of public comments. Comments are due May 5th, which is 1 month from today. Once we get the comments, we consider them all as we write the final version of the public health assessment. We always include an appendix in the final public health assessment where we summarize comments by theme and describe how we addressed each theme in the final report. You can submit comments to the email address listed here. Also, if you don't get your questions answered here or in the report, you can also email us at that same email and request and we can schedule a one-on-one conversation with me or with any of us to talk more about your question. And then finally, that last URL, www.healthoregon.org/EHAP. That's the URL for our main program webpage. And on that page, you can navigate to the Bullseye Glass, to our Bullseye Glass page. And there you can find you can find the full report. You can find a fact sheet that summarizes the findings of the report. And that's also where we'll post the recording of this meeting. Just give us a couple of days to get it up, and we'll also post the comments as we receive them on our website there, and we'll post these slides there as well. So that is my slides. I'm going to stop sharing so we can see each other's faces.
Yes, I'll jump in to say, see each other's faces. If you want to turn your cameras on, you are definitely invited to do so. If you'd like to, at this point, ask a clarifying question. It's a little bit different than sharing whatever you came in wanting to share, but actually based on the last 15, 20 minutes, 20, 25 minutes from David and from Julie. If you have questions specifically for David about the report, things you're still wondering about from the report, you are welcome to use that reaction button to raise your hand. I'm seeing Catherine doing that now, or put your name in the chat and we will call on you. We'll take a couple comments and then I'm going to jump in one more time. So Catherine.
Oh, I got to unmute my mic. Hi, thank you very much. Thanks, David, for your overview. I have a question very specific of something that I saw in the report about lead not being included in the analysis. And I'd like you to, could you go over why that was? I think it has to do with like technical reasons about having to measure the blood rather than what's in the air. However, I do remember there was a huge lead spike that caused a cease and desist, a second cease and desist from the governor or something. There was an intervention where Bullseye had to reduce their lead usage as well. A cap was put on that as well as the other metals of concern. So could you talk about lead for a minute and just how that was integrated into this assessment?
Yeah. So we did include lead in the assessment. Like it was a metal of concern, and we did assess risk from it. It's just that because the things that we know about lead and health effects are tied very much to blood lead concentration, the way that the assessment works is that there are models, computer models, that take an environmental concentration like in air or soil or whatever, and translates that into a blood concentration. And that works differently than calculating. That's just a different way of doing risk assessment than we do for the other metals, because we don't know as much about like internal concentrations of those other metals and what health effects are connected with that internal concentration. So yeah, there were 2 days of high lead that were measured at one of the monitors around Bullseye in 2016. And that, you're right, that was what part of what prompted the cease and desist order. Yeah, did that answer? Maybe I should pause and make sure that answered your question.
I think so. Yeah.
Okay.
Thank you. I mean, I read the report briefly, but I will go back and see. I thought it had been excluded from, but you're saying that it had not. So that's what I wanted to hear.
Right. Where we ended with it was so lead, especially in the lead in the soil and lead in the air after 2016 was similar to what you would find in other urban environments. So not to say that that's good or bad, but it means that like wherever you lived in Portland or even in another city, you would find similar levels of lead to that. Other than that 2-day spike.
Thank you.
Great, thanks, John.
Hi, John Karabek. I'm with the Brooklyn Action Corps. We had an air quality sensor installed in our public garden at Southeast Franklin and McLaughlin, which I didn't see on your sensor map. Is it because it was part of a different sensing effort, or is it just something that was left out of that sensor map?
Well, the monitoring data that we used were specifically testing for metals. I don't know if many of the sensors that people can buy online aren't specific to measuring metals. So I don't know if
this was a sensor given to us and financed as part of the Bullseye effort.
Oh, okay.
It's one that's operated by the DEQ, I believe. I'm not sure, and they're figuring out how to. I think it was paid for maybe by the settlement, and I just don't know what its role was in this study.
Okay, I am aware of those data, and I don't know if DEQ is ready to talk about them at all. But from what I've seen and what I've heard described to me by DEQ lab folks, the levels of metals and contaminants measured at those monitors are similar to what we found in the 2016 monitoring that DEQ did.
Yeah, David, can I add a little bit more?
Yeah.
Hey, John, my name is Matt Davis. I'm with DEQ. I want to clarify one thing, which is DEQ doesn't kind of own, operate, or assess the data collected by the monitors. That's done purely by a third party associated with the class action settlement. David's right that folks at our laboratory have looked at the data as they are available to the public online. And what we see there is that it's showing similar levels that we would expect in an urban environment. But I do kind of want to caveat that with it. We can't really speak definitively about it because it's not our data. So, thanks.
Great, and I just want to acknowledge that Catherine wrote something in the chat that we will get to after we hear from Chris.
Hi, sorry, I'm going to be off video tonight, but David, thank you for the presentation. 2 quick questions that I think I know the answers to, but I want to just make sure that I'm right and that everybody knows them. The month of data that you collected, or that the assessment is essentially based on, is that was during a period? Did Bullseye know they were being monitored that period, and had there been any? Did they change their operations or might they have changed their operations if they're aware of that? Were they aware of it? Let me just ask that. Were they aware they're being monitored at that time?
You're talking about the October 2015 data set, those 30 days?
I am.
Yeah.
The data that you consider the representation of their operations.
Right. The answer to that question is I don't know. I think other people on the call might know that. I'm not sure what communication was with the company when that monitor went up.
Gabrielle, you put your hand up. Is that to answer this question?
Yeah, I would want to double check and confirm. My recollection is that they were not notified of that. So at the time, this was not a regulatory type of monitoring that DEQ would do, for purposes of enforcing a rule. At that point, it was a research project. And my recollection is that the air planning folks at DEQ asked the lab to help them out to try and find, again, was this in fact the source of the mystery cadmium? So we can address this question in the PHA or posting the answer when we post all the questions. Well, we'll figure out how to post it, but I do want to double check with people at DEQ from the lab and get back to you. But I'll share my recollection from that time. I'm one of the few people who was around, who's on this call from that period.
If that is something, I mean, it seems to me that would be salient to put in the PHA. If you feel that's appropriate, is that something I would need to submit as a public comment, or is that something you can take on?
That's a great idea. No, we can go ahead and make sure that we address that in the PHA itself.
Okay.
We'll note whether, if it's not there now, we will note whether that monitoring was done, with or without the company's knowledge.
Great.
Thank you. That's a great idea.
It's been noted in the chat that we have some Bullseye executives on this Zoom. I don't know who people are. So if anyone else wanted to answer that had that knowledge, you're welcome to do so.
And then I also had a second thing that I wanted to ask that should be even faster, but I'll wait till.
This is
Uh-oh.
Let's mute if you're not the one speaking, and that might help with the echo. Okay, I thought somebody was going to speak. All right, so if that wants to happen, we can have that happen in a little bit. I'm just going to take a minute to say a couple more words in my role as facilitator, and then we'll get back to the queue and the comments in the chat as well.
Okay, can I ask my second part of my question?
Oh, sure, Chris. I wasn't sure if you wanted to do that now or later.
David, you may have said this at the beginning of the meeting, but who, in terms of, have other governmental agencies or scientific agencies reviewed this report?
You're muted.
Oh,
Right. You'd think after all this time that would never happen to me, but the report went pretty far through the review process at the Agency for Toxic Substances and Disease Registry before we got to where we are now. So the report substantially includes a lot of their input and review. DEQ also reviewed it to make sure that the statements that we made about their data were accurate. So I think those are really the only two agencies that did reviews besides internal review in our own agency.
Dave,
Okay.
I thought EPA also reviewed the report.
Oh, I think that's right.
Yeah.
I think that's right. EPA did too. That's right. Region 10 EPA.
Yeah.
Up in the Seattle office.
okay, thank you.
Okay, Marnie, just one quick pause, and then we will also come to you and then the chat. I just want to take just a moment to have us just pause for a moment to consider everyone in this space together, to think about what, if anything, would closure around Bullseye look like to you? Do you have that now? Is it possible to even have a version of closure in the face of uncertainty? What could that look like? So we know that you may have fears and concerns that there are long-term environmental health issues because of this report, because of your lived experience, because of whatever reason. So as we move forward for our last 20 minutes of official time and then more time sort of unofficially, although I think we've decided to just keep the recording going, what do you need to feel heard? So whether that's tonight or in the public comments. So from that place, we'll jump back in. So we'll go to Marnie, and then I'll come to the chat, and then I'll get back to you, Guy.
Hi, thanks everyone for the presentation. My name is Marnie Spoons, and I was part of the Community Advisory Committee. I have a question. I had a comment, but it seems like this isn't the space for that after all, which I thought it was going to be. I will just say that closure looks different to everyone, but you know, for me, someone who is navigating and coordinating doctor's appointments and tests and surgeries for a loved one with rare, mysterious health ailments that doctors are stumped by. I don't have closure. And for some folks in the neighborhood, closure means death. And I have a question. I noticed, David, that you emphasized that the data was very clean and good quality data. And I'm wondering if you can talk about the data that was.
I think you froze, Marnie.
I think we know where she was going, but hopefully she can hear. I wonder if we can wait to answer until she gets back online.
Okay, yeah, I think I know where she's going to, but maybe since it's her question, we should make sure she's on before we answer it.
Yeah.
Okay, so we will come back to you, Marnie. Oh, wait, are you back?
Yeah, when did I freeze?
At a really salient point, you were talking about the data. Can we talk about the data that is? Oh, and now we can't hear you. If you'd like to write it in the chat, we can do it that way. Thanks everyone for your collective patience as we navigate this together. Give Marnie just a moment more. Okay, talk about the data that was not admissible.
Okay, I think, yeah. So you're talking about specifically the chromium data from the October 2015 data set. There was a data quality problem that was discovered with those data, and that is part of what took the report so long to come out, was figuring out how to approach that data quality problem and how to address it. So when I was talking about lots of very high quality data, that's talking from 2016 onward, like the data representing current conditions. With those data, it's very high quality. The problem with and I guess maybe I'll start answering that question by talking about like what conclusions that missing information affects in the public health assessment. So it plays into that exposure scenario that I described, where we took that October 2015 data and extended it for 78 years into the future, and talked about long-term health risks if those conditions had remained stable at those levels for that long time. And that missing that chromium data does lead to an underestimate of risk. So we're underestimating risk because we know that chromium was used, but we don't have chromium data for that time that was measured using the October 2015 data. We also have some assumptions in the report that probably overestimate risk. Like we're assuming 78 years of exposure, and that's unlike. We know that no one has actually been exposed for 78 years because Bullseye hasn't been there for that long. So on the time component, we're overestimating risk. Missing the chromium data, we're underestimating risk. So we just don't know like how that washes out, like which of those things wins out. Even just using the data that we have for cadmium and arsenic, we know that that a long-term exposure to those levels of metals would have could have harmed health. That the levels were high enough to harm health, even just looking at cadmium and arsenic. So having the chromium data wouldn't have changed our conclusions. Like we already have a finding that levels were high enough to harm health, even without the chromium data. We're underestimating the actual numbers, the magnitude, perhaps, but we already are concluding that could have harmed health. So having that data wouldn't substantially have changed what our conclusion is for that scenario. It wouldn't have made up for the difference of only having 30 days. So we still wouldn't have been able to look back at what risk it actually is for people who were there, who have been living there for a long time, because even if we had the chromium data, it would still have only been 30 days. And the problem was extrapolating backwards like that is we just don't know how well that October data reflected like all of the history of Bullseye's operations. And if we have Appendix D in the report. I wrote the page number down for just such a question as this. It's on page 96 of the report. That has a lot of details about the data quality problem with the chromium data. And honestly, we kind of like, I'm not like a chemistry analyst person, so I can't go into a lot of detail about like what actually was wrong with the chromium data. I know that it didn't affect other metals. So the data quality problem only affected chromium and not other metals. But perhaps that's something, if people are interested, that could be part of the follow-up meeting for the DEQ's planning for more detail about it.
Thank you. Thanks for all these questions and keeping them coming. I see hands up. Just gonna kind of collect where we are for a moment, and then I've got the queue here. So one thing I wanted to collect was in the chat. We had a couple comments from Doug, sort of naming a couple Bullseye people, specifically Eric Duran. I might be saying the name wrong, pardon me if I am, and Jim Jones. Jim mentioned in the chat that, let's see, that Jim Jones wrote, that we were notified by DEQ that the monitor in October 2015 was going to be installed. Chris asked, did you change operations during the monitoring period? And Jim says, no, we didn't change our operations. I guess I'd like to just give the opportunity before we go back to the queue. Jim, if you wanted to say anything more with your voice, this would be a moment for you to do so. And I'll take that as a no for the moment. You're welcome to later if you would like to. Dan, if you'd like to also share with your voice, you can raise your hand. I know that Catherine, I see your hand up sort of first in the queue, but I had Guy already was in my queue. I had just lowered his hand. So, oh, there's a feedback issue. Oh, that was right, because when you turned on your mic, it gave all that feedback, Jim. Do you want to try one more time? We've all got our mics muted. Dave, you could mute yours as well, and I'll mute me and see if that works, Jim.
I don't know, is that working? That works. Yeah, as far as knowing that the air monitors were going to be installed, we did know that. We were notified, and we didn't change our operations. We had no reason to. So we asked DEQ just to let us know what happened or what happens with the data. And we heard in February, along with everyone else.
Okay, thank you for that. And I know that there are lots of questions in the chat as well as hands up. I'm going to go next to Guy. And Catherine, just to let you know, I've seen in the chat that you've got 3 or 4 questions. I'm tracking on them. So we'll hear from Guy, we'll get some of yours, and then we'll go to Heather.
Yeah, my question, I don't know if this is really pertinent to the scientific findings that you're discussing, but I guess it speaks to the issue of what would constitute closure. I think the most troubling thing for me that remains open as a question is a number of years before, my understanding is a number of years before these revelations came out in 2016 about these high levels, that there were some high level officials at DEQ who got wind of a rulemaking that the EPA was going to issue or was looking at issuing that could have regulated these emissions. It might have reduced these emissions substantially from Bullseye. But this official at DEQ actually approached folks at Bullseye and said, why don't you go and get a carve out and you don't have to comply with these regulations? And that came out in articles, I believe in the Portland Tribune, I want to say, and maybe some other newspapers. That's incredibly disturbing to me because, it seems like some of these problems might have been avoided if that hadn't happened. And it speaks to, a culture of kind of collusion, which if those reports are correct, may have existed at DEQ. Does it still exist? Has there been any consequences for people, engaging in that kind of approach to regulation? Is there any way to prevent that sort of thing from happening in the future? Are those articles just wrong that I read? I guess those are some of the questions that I might want to raise in terms of trying to seek closure on this. Thanks.
Gabrielle, I can try and take a swing at that, which will not be a satisfying answer because I think the time period that you're talking about, nobody on this in this meeting or in the past 5 years since all of this happened were around at the time that you are talking about. So I can't speak to it. What we can speak to is what happened. And I think, hearkening back to some of what Julie was pointing out, I think Julie made one mistake. She said it was weeks, but the East Side Portland Air Coalition, in my recollection, formed almost overnight and had 100 people at a meeting the next day. So there was very strong community engagement and the sense of thinking that the state knew what was coming out of facilities and we didn't. And it was a gap, like we were talking about, the federal government, EPA, doesn't regulate based on seeing what's coming out of the facility and who's living next door to it. And that's the program that we now have developed with, at the behest of the community, with a lot of the involvement of community, including a lot of people on this call, and folks like Senator Taylor and colleagues in the legislature. So we can speak to what came out of this now, and so we don't have the conditions that you're talking about. We now have a Clean Air Oregon, a pretty unique program in the country that is measuring and asking facilities, requiring facilities to tell us what they're emitting and doing that risk analysis based on who lives nearby and asking people in the community how they live and what are their schools? Is there a park where they play? You know, we can go more into Clean Air Oregon. Actually, DEQ, if there is a follow-up meeting, yeah, that'd be another good focal point to explain how that is working out. But we just don't have, the world has changed for the better, much better in terms of being able to regulate to protect health for neighbors who live near industrial facilities.
Adding from the chat from Dan, that news of Bullseye going to the EPA and getting an exemption was broken by Rob Davis in the Oregonian and corroborated by Daniel Forbes in the Portland Mercury. It was way back when, not current DEQ staffers. There were 759 people at the meeting at Cleveland High School. And just a little time check here, it's 7:25. Just to remember, we will keep this room open for longer, until 8 o'clock specifically. We will keep the recording going as well, but we also want to make sure people know they can leave. I mean, obviously, of course, you can leave whenever you'd like. We're going to sort of be officially ending at 7:30, just to know that. And if I think this would be a good time to sort of drop all those initial links in the chat in terms of how to make official comments, and that doodle poll again if you want to join a DEQ follow-up meeting. And what they've requested is that you don't put your name for your request for the doodle poll, you put your email address so that they can follow up with you. So anything that needs to go in the chat for that will go in the chat. And thank you so much, Lauren. And Catherine, I have actually, sorry, before I go on, Gabrielle, is there anything else you want to mention sort of in terms of like the official wrapping up and then we'll keep going?
Right. Yes. Right. So I will just, I think you covered part of it with just, again, the links, but also you can just search Oregon Health Authority, Bullseye Glass, and it'll also get you to a place where you have the PHA, public health assessment, the email to send in comments, all of that. A reminder, again, they're due by May 5th. And we'll post on that website, we'll post the recording of this entire meeting or a link to it, as well as the presentation slides. It'll just take us a few days to get it up there. So certainly by early next week, we will have everything up and available. And if you still have questions related to the PHA that haven't been answered yet, again, we're going to stay for a bit now, but you can also use that same email just to ask for a one-on-one meeting with any of us. So happy to follow up and have conversation, as much conversation as you want with us. And again, if you have more DEQ focused questions that we haven't gotten to, fill out that doodle poll that Lauren Wardis from DEQ has been dropping into the chat, and that'll help them schedule a follow-up meeting. And a reminder, put your email address in there. That's how they're going to let people know about the meeting. You can forward the information to let other people know about it, to join in. And I'll be staying until the end with all the people who last the whole time. But for those of you who need to hop off, just thanks so much again for joining us. And we look forward to seeing your comments. And again, I will actually do that drop off, but I did see a question from Catherine about wanting to know what contributed to all the delay, so I will get to that. But for anybody else who needs to hop off now, thank you so much for coming tonight. And we'll get back to, I'll turn it back over to you, Sandy.
Okay. Yeah, and so Catherine's up next. Catherine, I've been tracking. You have a question specifically for Gabriella around why did this PHA take so long? You asked for the unpolished and messy version. You also had a question around how far back research went into potential local cancer clusters, and questions around historical metals chat. So I'll sort of pass it to you to see which question you'd like to address first.
Oh golly, I don't care what order they come in. I have one more question too, which is why I raised my hand. So we can start there since the others are written down. I was just curious, there was issues with deposition of metals on the roof of the Bullseye facility. And I was wondering if there was any work done during the public health period on deposition on other rooftops in the area. And I'm thinking in particularly of Cleveland High School, of Winter Haven, and of any other flat roofs in the neighborhood, because it is kind of an industrial area. So I'm just wondering, because that seems like sort of a gray zone, like stuff can blow off, become part of the air, depending on, so I'm just wondering if that was part of the research when you were testing air and soil. That's a question for David.
Yeah, so anything that like lands on a hardscape surface like that is eventually going to end up in stormwater runoff, right? Eventually it's going to get like washed somewhere. And so our thinking was that so a lot of that would be captured in soil. Like, so some of it would go to just some stormwater runoff just goes into the system and goes out into the river or whatever.
I want to interrupt you for just a second, because we just had this huge wind event in the neighborhood, right? And so wind would pick it up and take it into the air, right? Any particles that were light enough to be lifted, yes? And if there was enough, it would be significant.
I suppose if it was very dry and dusty, when that wind event happened, I mean, it's often wet, but not always. And again, I think eventually anything like that eventually that stuff ends up on the ground. It would end up becoming part of the soil that, so over time, we're pretty confident that the soil sampling was pretty representative of all of that kind of stuff. Like anything that would eventually land on the ground would have been captured with the soil sampling. Yeah, for the stormwater, we didn't really evaluate stormwater because there wasn't really like an exposure pathway for people, because there would be so much dilution between the time it got from the stormwater near Bullseye out to the river or wherever the outfall is for the stormwater system. But you know what I mean? It's not like there's like an open. It's not like open. Like in some places, there's like open ditches where stormwater runoff goes. In this urban environment, there's not. So there's not like a place for people to get like into the stormwater until it gets discharged somewhere bigger.
Yeah. Okay, thank you.
Catherine, why don't you go just with at least the next question or Catherine's question for Gabriella related to the length of time to get to this PHA.
So the messy part, the more straightforward part is candidly the past 2 years, OHA has had other priorities. It was all COVID, and even for environmental public health. So so the last the additional 2 years, or the last 2 years of the 6-year wait that we've had was because of that. So prior to that, and I'm going to ask Dave and others who committed more firmly to memory in terms of the timing. I think by 2017, we were close to a draft, or was that 2018? It was
2017.
Yeah, it was fall of 2017. And that's when the error in the data, specifically the
chromium
hexavalent
data.
chromium, I'm sorry, the chromium data. Well, we didn't know what kind it was, but the chromium data really came to the light and brought everything to a screeching halt. So in terms of it sent DEQ down a path to research what had happened with the data. It put ATSDR, the Agency for Toxic Substances and Disease Registry, who is our federal partner, put the brakes on, and they had a long internal consultation, which we just didn't hear anything from them for a long time. We know that during that time they were doing technical consultations with the Environmental Protection Agency. And you know, being very candid, I think this incident may have prompted that agency to revise its policy for certifying public health assessments. They came out during this period with a new policy that they would only be certifying public health assessments for Superfund sites. So I think this was a very challenging thing for them to get feedback from us, or for them to get us feedback. And we, at a certain point, and after consultation with the Community Advisory Committee, you know, we said, look, we can either wait until we don't know when for this information to come from CDC, from ATSDR, or we can go forward and finish it. We did get a memo from them identifying the technical issues, really, especially relating, or solely, I think, relating to that chromium data and what they thought was defensible scientifically and not defensible scientifically. You know, so it was the chromium data. It was also, I should say, it wasn't only that, it was also the validity of extrapolating backwards for 43 years. We got feedback from them about that. So they provided a technical memo, which I think we have available on our website. I don't know if you can give me a thumbs up on that, Dave, if we have that technical. Yeah, that is available, the memo that we got from them. So that gave us guidance on how to move forward, but the community was very interested in having that third-party certification from that federal agency. And at a certain point, you know, we were deciding to go forward or ask the community about going forward without it. And that's when COVID hit. And that put both our federal partners and us on a different trajectory, even though it's different parts of our agencies. It was all hands on deck. So half of the environmental public health section was running contact tracing teams and, you know, not doing their environmental health jobs for quite some time. And also we just wouldn't have been able to get our leadership's attention to review a report and get it through, because we do have to run these types of reports all the way through to the director. So I think that was the case for both the federal agency and our agency for the past couple of years. So Dave, I would love you to add or correct anything that I've said about this messy process.
Yeah, it's mostly all correct. I just wanted to also mention that the memo that you were mentioning, the memo from ATSDR, is in Appendix D of the health assessment report. So it's right there to read. And another thing, so part of the delay early on was, you know, we wanted to use a year's worth of air monitoring data to evaluate the current conditions. And to get a year's worth of air monitoring data, you have to wait a year. Right. So it wasn't until like April 2017 that we finally had all of the environmental data to start writing. And then we had that in April. and August of 2017, we had a draft submitted to ATSDR to review. So it wasn't really that long before we had a draft turned around. It just, all of the things that Gabriela mentioned sort of bogged it down. I would also, one other bucket of work that became part of the delay was it was the same staff, like it was the same people that were writing the public health assessment were also trying to start Cleaner Air Oregon and start this new regulatory program at the same time. So that was some part of the delay also.
Great, thanks for those answers. There might be more questions related to that, but we're going to go next to Heather. You put a question in the chat. I don't know if it's the same one or a different one, but go ahead.
Yes, I have a colleague who owned a building. He may still own it. That was just down the street from Bullseye, maybe a block and a half. And he had a small child. And so since he no longer lives there, I'm curious how folks that may not necessarily be living in those same locations but may have been impacted are being notified by about the report and about the opportunity to comment. You know, as as a parent myself of a child who recently was diagnosed with a kidney issue, I'm concerned that there are other things, that could be at play here. And, it's hard to know what impacts are related or not. And I just want to make sure everybody gets noticed about that. So if you could speak to that, I would be really appreciative about that. And then also, I would just add on a question about water impacts too, and water runoff, if things are collecting on the street, and is there any opportunity to kind of look at other agency data related to water quality monitoring that may have other high concentrations of some of these that might be considered. Thanks.
Maybe Julie can take that first one about notifying people.
Yes, thanks, Heather. We have, we collected, some names or, contact information, I think in the beginning when people who might have expressed interest. And I think even at some point we had a listserv. But that really dropped off, and I don't think we did get probably a lot of names of people, especially maybe homeowners who aren't living near the facility. But we can look into that. It sounds like you might know someone, so hopefully you've shared that, but we can look into see if there's how we might be able to get the report out to some of those folks, especially who are real close by.
Yeah, I know there's a lot of kind of property owner data, and you can send out a postcard mailing. So you might consider doing that if there's a chance to push out your month of comment window to ensure that people actually get a postcard to participate in that. I think not everyone is, especially older folks, are on email. And so just making sure that there's adequate notice of that would be, I think, really lovely. And I just want to appreciate all of you for being here and taking the time. As a former government planner, I really know how challenging this work is. And so just want to express my gratitude.
Thanks for that. I wanted to just circle back on your second question about stormwater. I think we could talk, so OHA, we can speak to whether stormwater would have been included in the public health assessment, if that was your question. If your question is more about stormwater now, kind of now and in the future, that would be kind of for DEQ probably to answer at their follow-up meeting.
I think I was thinking more about, the more extreme concentration times, if there's any opportunity to look at what other kinds of water quality monitoring was happening, and if there was any sort of impacts that might be looked at. To just know how much you've done.
I think Dave, that gets to that question of what are the exposure pathways, right? So Dave, if you could speak to why stormwater was or was not, I know it was not included in the pathways you were looking at.
Right, part of the assessment, and we talk about, for every public health assessment, we do like an exposure pathways analysis, and we thought of that one, like stormwater runoff. And because it's an urban environment where storm drains drain underground pretty quickly. Like there's not too many places where there's like a long stretch of runoff on the surface before it goes through a grate or something. So what that means is that there's not really a pathway for people to be exposed to those metals in the stormwater runoff, and until it gets much further downstream, like after it's gone through the whole wastewater treatment system. And
we have underground creeks, and we've got a giant park right there, and water, groundwater, sort of like water bonding to these chemicals in the air, and draining down through this large park that we have. And I'm just curious of, it may not just be impacts to humans, but also to fish and other habitat too.
Yeah, and that could be, we, as a public health agency, we focus first on the people. We always ask DEQ the questions about what it does to the fish.
And people eat the fish. Right.
I just want to note for Heather, if you're interested, there has been stormwater sampling and investigation work at Bullseye, and I believe a couple of years ago, enforcement action also, and that's all detailed on DEQ's Bullseye webpage. And I'm happy to chat kind of more about that history if you're interested. So thanks.
Thank you.
Okay, time check and order of what's happening. Thank you, Heather. We've got Chris, who's been very patient. Thank you. Charlotte asked a question in chat, which Matt answered, although after we hear from Chris, if there's more to be said on that question in the chat, we can go there. And then Catherine, I'm aware that you had 2 more unanswered questions, and I've been trying to parse them through so that we get to hear from multiple voices. But I know that you do still have at least 2 pending questions. So we will go next to Chris.
Great. I'll try to be more articulate this time. So I have a technical question for David, but before I do that, Sandy, I'd like to maybe take a quick stab at answering your question about closure. I'm not a big fan of closure, but one thing that I think would be helpful for me to see, like, there is something good that came out of this, kind of builds on what Guy was saying. So Guy described a scenario which we believe happened where DEQ was aware of a rulemaking process that would affect the emissions, potential emissions of a polluting industry, and they took the step of notifying the industry to try to give them an opportunity to try and influence the rules. As far as I know, they did not likewise notify the public, who would be also impacted by that situation. So I see that not as, I don't think DEQ did anything illegal there, but I think they did perhaps do something that I would describe as falling far short of their due diligence as an agency that's entrusted with protecting the public from environmental hazards. And so where I'm going with this is, one of the things that would make me feel better about this is if I knew that the culture at DEQ had changed and was now one of protecting the public first and foremost. I do know the Cleaner Air Oregon rules to the extent that I know them and have been tracking them and understand them, which is not a great extent, but I do believe that they are a fundamentally new and beneficial approach, and I see that as good, and also an astoundingly rapid response, which I think is also good. But I guess what I really like to know is, what are some ways that I and other people can assess whether the DEQ really does have the public's best interest in mind. If they see something, will they say something? And I've spoken for long enough on this question, but I will say I had 2 interactions with DEQ people, one of whom was involved with the Bullseye situation. She's no longer with DEQ. That really underscored the fact that she knew there was bad stuff going on, and she didn't tell anybody. I mean, I know that because she told me that. She said, well, don't do this because that's dangerous. And I'm like, well, why don't we tell people? Well, we don't tell people. That's not our job. So how can we figure out if DEQ really has changed? Maybe that's not even a question that can be answered, but that's something that I'm struggling with.
Chris, I don't think I can answer it in a way that will provide closure if that's the goal, but I think what I can do is acknowledge the the skepticism and distrust you feel in the events that you're kind of describing, and how that would lead to that. And I think the only way that you can that DEQ can kind of restore your faith in us as an agency is to observe our actions moving forward and watch how we roll out regulatory reforms that Gabriella mentioned, and also just how we do our day-to-day work of regulating and inspecting facilities. And I kind of just recognize that's probably not the most satisfying answer, but I also, you know, as kind of one person that's part of a system or a bureaucracy, I think that's kind of the best I can do as an individual on the call. So.
If I can add, I mean, one way to do that, and it takes time, but there's always a public comment period at Environmental Quality Commission meetings. And you can pose a question to the commission. They're the ones who oversee DEQ, and they can ask leadership to, you know, answer that question. So that's a suggestion that I have.
Yeah, that's a good idea. Okay, thanks for the answer. The technical question for Dave. This is one I've asked you before, and I don't know where we ended up on it. So I asked you probably during the advisory committee's existence. But has anyone really come to grips with the chemistry of chromium in air and in furnaces when it gets heated? I know the furnace is a reducing environment. When it gets, so you have a reduced form of chromium, it's hot, it hits the cold oxygen air as it comes out of the smokestack. I've tried to do research on that as a layperson, and nobody really seems to understand it. And I think that would be helpful to really at least drawing a circle around what the potential damage from, or what the potential harm posed by the chromium that we know is there, but we just don't know if it was the harmful form or the harmless form. But if we understood what the chemistry was, it would be, you know, might be able to say, okay, we know that worst case, it probably wasn't bad, or, you know, we could probably make some broad general assessments about it.
Yeah, so that was one of the things that they were able to determine early on with some source testing, where they found that it seemed like whatever form of chromium went into the furnace, it was always hexavalent chromium that came out the stack. So you're right that the furnace itself, it converts whatever chromium into hexavalent. We don't, I think we know a lot less about how long it stays hexavalent once it gets into the air, like once it exits the stack.
Right.
One of the reasons that hexavalent chromium is so toxic is because it's very reactive. It wants to become trivalent chromium as soon as possible. Like it wants to do that, and it's that conversion process that actually causes the damage. Like when that conversion happens in reaction to a cell in our body, that is what is causing the toxic effect. But it also wants to do it with anything else before it gets to our, like the first thing it comes in contact with. So when it binds, we know that once hexavalent chromium lands on soil, it's a pretty rapid process to get converted to trivalent chromium once it's in soil interacting with organic stuff, because it's, as soon as it is in contact with something organic, it'll convert from Chrome 6 back to Chrome 3. So that's not. So I don't know. I guess the answer is it sort of depends. We know that what comes out of a stack is mostly all hexavalent chromium, but we're not sure like how long it stays like that once it exits the stack. It could even make that conversion in the air to some extent. There's even some conversion that happens as it interacts with other like water droplets in the air or other particles in the air.
Yeah, I believe that's entirely possible. And I guess I know that you don't know the answer, but does anybody know the answer? I mean, that's the thing. Is this just some like frontier of science that nobody really understands what the dynamics of hot hexavalent chromium in atmosphere are?
Chris, my recollection is that this was eye-opening science to EPA. And so just kind of, well, I'll let DEQ talk. They do much more science than we. I mean, we as OHA, we research the research, but we don't we certainly don't do that kind of science. And I think even DEQ, I'll let you confirm or not, but past a certain level, that's the realm of EPA and academia, that state agencies just don't have the resources to, to develop that kind of science. But I think that this whole gap that we have is because the way air toxics are regulated by the federal government, EPA, assesses what industries, what facilities are out there by type of facility. And if they think it's a potential source of air pollution to the airshed that would, cause harm, not only to the airshed, but then they develop regulations for that specific industry. So it's a very different basis of regulation than what we're doing with Cleaner Air Oregon. And they apparently didn't think that small glass facilities, these are small, these are not like big bottling manufacturers, that small glass facilities, we're operating at too small a scale, or, for whatever reason, they didn't think that this was a source that required regulation. And so, this event here in Oregon was new information for EPA. I do remember that at the time.
Hi, Chris, this is JR Giska I'm the CAO program engineer, and I just want to sort of chime in a little bit to your question. It is a great question. It is technically something that is very challenging to answer. And it is something that is emerging for a lot of other agencies. I know that South Coast Air Quality Management District has recently made a rulemaking for hexavalent chromium testing at metal foundries and facilities like that. So the science is definitely developing. All of the things that Dave said are accurate. It is highly reactive. I think for us in the CAO program, what we're looking to do is facilities that have large amounts of chromium emissions. We are requiring source testing using methods that would determine the oxidation state for that. So that is something that we are using the CAO program to do, is to gather that information. So it is a tough issue, and it is very specific to the site, the process, the heating, the redox of the entire thing. So there's lots of science in there, and so that's for us. We just want to get in there and do the testing. So I think that's where it's at right now for us.
Yes. Okay. Yeah, I didn't expect you would be doing the science, but I thought maybe you could ask somebody who had. But okay, I understand what you're saying. So thanks.
No, we have actually. We've gone to academia and we've gone to like papers, and there's just not a lot of other than bench scale reactors of combustion and looking at those conditions. Which really don't mimic real world conditions. But yeah, and I'm happy to set up a time and talk to you about the soft line too.
Okay, I'll think about whether that would be worthwhile, but thank you.
Well, quick time check. We are at 7:58 p.m. I know that we have a couple people still in the queue, and maybe those that haven't raised their hands. Anyway, just to acknowledge that, we had, just to give a little bit of information, Charlotte has been chatting with some folks from the DEQ. It looks like they'll all meet to discuss a couple of topics related to Cleaner Air Oregon, as well as looking here at the end, meteorological data inputs would be welcome if questions remain. So a couple side conversations there. I think the chat will also be part of public record. I'm not sure. Yes. Okay. Getting confirmation from Gabriella. So things that are in the chat will go in public record, which is different than your comments. So again, putting the links again one more time in the chat, Lauren, with all of the important links and how to make public comments and following up on the DEQ doodle. So that was with Charlotte. Catherine, I just want to acknowledge that you did still have at least 2 pending questions. So apologies that we couldn't get to those. And Heather had also written in chat some ideas, shall we say, comments for DEQ specifically related to restoring trust and ensuring a culture of openness related to policies, having strong whistleblower policies in place if that's not there already, and building that into the culture through annual trainings and other things of the like. And the last things I'll say is that I said at the start, if you were here at the start, you may remember me saying that there wouldn't be enough time tonight. And that even though I asked you to consider what closure might look like or feel like, that we wouldn't be promising you closure. So I think that I delivered. I think that we want more time and it would be great to have more closure. So I just want to thank you all for coming and for sticking out to the final minute here. You brought your heads, your hearts, and I really appreciate all of the care that you're offering from each angle that you're bringing. And those will be my parting words, but I see your hand up, Dave.
Yeah, I just wanted to make sure that people heard about I'm really serious about talking with people one-on-one. Like it's like I really enjoy doing that. And I mean, we knew that we couldn't answer all questions in 2 hours. And so I really hope that people will take us up on that and email the ehapa.info email to schedule something, because I'm like I very sincerely enjoy doing that. So please do, if you still have questions, especially detailed ones about the report or anything, I really am happy to talk to people about that in one-on-one conversations.
And I just wanted to add something regarding the transcript that I think you used the term public record, Sandy, and this is not a regulatory forum. So this isn't, I'm sorry, it's a public record. I can't remember what term you used, but it's not public comment. I mean, it's just us wanting to be transparent and sharing stuff. So because we have access to the chat, we can save it as a document and make it available on our website. Along with, as much information as we collect, we will put it on the webpage. But again, for us to be able to include your statements in the final public health assessment, please send us an email with those thoughts, and we will respond to them formally in summary format as we identify themes and address all the themes, and then include your written comments in their totality in the final public health assessment report. But again, all this ancillary information that we have from the chat and from the recording, we'll make that available as well. But just wanted to be clear about that. And again, I like how you put it, Sandy. You brought your heads and your heart to this conversation, and took a big chunk of your time when this issue has taken a big chunk of your thoughts and lives and concern for so long. I hope that the other good thing, I really do want to say that Cleaner Air Oregon coming out of this, and thanks to all of you, to the community, it's a really big deal that we have a way to address the impacts to people who live near these facilities, and we didn't have that before. So just a thank you for that. Your voice made a difference, a big difference. So with that, I think we can.
Yeah, thank you and good night.
Good night. Bye-bye.
Good night, everyone.